Hello, everyone, and welcome. Thank you so much for joining this session, which is part of the Skoll World Forum Ecosystem Day and is curated and hosted by Nexleaf Analytics. We are so fortunate to have our panelists with us, so let's dive right in. I want to start with a quote from Dr. John Nkengasong, who recently testified in front of the US Congress. And he stated, "It's my belief that we need to capitalize on the capacity and experience of those in the countries where we work, coming to the table with a deep respect for their perspectives and needs and taking into account their knowledge and local expertise." And I couldn't agree more. Dr. Nkengasong represents a new approach to global health, which is characterized by this commitment to human potential and equipping those closest to the problem with the tools that they need to solve their own problems. So today we are dedicating this session to hearing from country leaders who know their country's successes and future opportunities best. So I am so excited for you to hear directly from them. Quick housekeeping before I introduce our guests. To access the chat function, you can navigate to the bottom of your screen and click chat. And to access the Q&A tab, you can navigate to the bottom of your screen and click on Q&A. And what we'd really love to see people do is just add your questions for us while you're listening. And we have Alex from our team who will be looking at the Q&A and will therefore let me know what the questions are. And we'll aim to answer as many of your questions as possible. And we'll allocate the last 10 minutes specifically to the questions that arise. So please do share your questions and we'll make sure to incorporate those for our guests. So with that, let's get started. I'll introduce our speakers briefly so we can get into the conversation. We have Dr. Andrew Lakaka. He's from the Ministry of Health and Population in Malawi, where he's the chair of the National Quality Commission for Health Systems, director of Quality Management Department, and head of eHealth. Then we have Dr. Hassan Sibomana, Ministry of Health from Rwanda, and manager of the EPI, or Expanded Program on Immunization. Next, Dr. Lucy Mecca from the Ministry of Health in Kenya, and she's the head of National Vaccines and Immunization Program. And finally, to bring the continent-wide perspective, we have Dr. Wessam Mankoula, lead of Emergency Operations Center from Africa CDC. These leaders have decades and decades of experience between them. So we are in for a real treat. So Dr. Lucy, let's start with you, please. Could you talk about what are you most proud of with respect to Kenya's COVID-19 response?
Yes, thank you very much for this opportunity to provide an insight to our experience. What I am most proud of in Kenya is the resilience of the routine immunization program, on which the COVID-19 vaccination exercise was pinged upon. Because through this, the staff who used to deploy the vaccine, the infrastructure that was used to deploy the vaccine, and also the coordination mechanisms, including the immunization technical advisory groups, were in place for routine immunization, and therefore COVID leveraged on this. So, and also for the routine immunization bouncing back just after a dip during the pandemic and coming back strongly and maintaining high coverage during the pandemic and also during the vaccination exercise also shows how resilient the program is. And that is one thing that I'm really happy about. Thank you.
Dr. Lucy, you've also spoken about innovations, and especially in the context of all of the different, uncertainty and different moving pieces. Do you want to also share a little bit on that?
Yes, we have seen also innovations really bolstering the efforts on COVID-19 vaccination. As you know, we had special considerations for some vaccines and the temperatures for storage as well as transport. And we really ran into some uncertainties on how we were going to monitor the transport using the equipment that we had at the time. And therefore, we had to look into the scope of equipment that we had that could monitor extended a range of temperatures, especially during transport, and help us to transport vaccines that need sub-zero temperatures. For example, we needed transport Moderna, we needed transport Pfizer. And to monitor this, there's a gadget that we had just learned about, that was the Trek. And we managed to use it to monitor temperatures during transport, just to ensure that the quality of these vaccines is maintained. Of course, that was more of an innovation. At that point, there were not a lot of guidelines on what you should use, where. So it was, I can say, a very good innovation on the part of the vaccine supply chain in Kenya.
Thank you. And Dr. Hassan, maybe the same question for you. Could you speak to what you've seen in the Rwanda Ministry of Health's response to COVID, and what really stood out to you as some of the major successes there?
Yeah, thank you a lot, Dr. Nitya. Thank you for this opportunity to talk about our success in Rwanda. So actually, for us, I have to say that really we are very proud of the good achievement today. The coverage of COVID-19 vaccination is very high. So our target is to reach 70% by June. But if you look at our coverage today, so now we are at 63% fully vaccinated. And also starting December, we started also to provide booster dose. And at the beginning, really, I have to say that it was very challenging because there was no hope of having access to the COVID vaccine. But also what we have seen, to have vaccine is just one thing, but also to turn vaccine into vaccination, also it is another thing. So we also had a good support from different partners, our stakeholders, but also I have to say that also our community was very collaborative, and also if you look at the adherence of our people to the vaccine, so actually we didn't have so many challenges, so communication was very easy. So we didn't have really hesitancy to the vaccine, even though there was so many rumors circulating on media. So actually we are proud of what we have achieved today, and our aim is also to achieve 70% by June this year. So you can understand, to achieve 70% by June. So actually that is also the global target. And also I have to say that in September and December we achieved the global target, because in September last year, actually it was the objective was to achieve 10%, and for us, we at that time we had 13%, and also by December we achieved 43% instead of 40%, which was required globally. So we think that really this is a good achievement. Thank you.
Dr. Hassan, you've spoken about also the success in kind of leveraging the existing infrastructure. And just as context, I'm sure all of us are familiar, but I think all too often in global health, there's this instinct to just build from scratch. And so one of the things that I was really struck by is that you had talked about the existing infrastructure and how that was leveraged as part of the COVID response. Could you talk a little bit about that in terms of the equipment, the personnel, the community health worker system, sort of how the ministry leveraged existing infrastructure?
Yeah, thank you, Dr. Nitzia. So it seems like when this pandemic started, actually it seems like we were very well prepared, because I remember at the end of 2019, so actually we inaugurated a new warehouse for vaccines at central level. And we had also the chance of equipping with new cold rooms. And if you look at the capacity we have today, so actually it was very, very easy for us to host any new vaccine. So if you look at the number of doses we received for COVID vaccines as of today, so now we have received 23 million doses. And if you look at all these number of doses, so actually we added the only equipment for Pfizer vaccine, because you know, for Pfizer vaccine, to keep this vaccine, it requires new infrastructure, new equipment, ultra low temperature cold chain equipments. So actually we didn't have this equipment before. So we used to have two ultra low temperature refrigerators. So those one we used for Ebola vaccine, but ready to add this COVID vaccine. So there was a requirement also of increasing our capacity. So if you look at it in terms of equipment, we were very well prepared at central level, but also at lower level in health facility, because actually we didn't buy new refrigerators. We used what we had for routine vaccination. But also if you look at how we are tracking data of vaccinated people, so actually we are using immunization tracker, and it is the same system we have been using for routine vaccine. And it is DHS2, which is very accessible and very easy to use. And our staff in different health facilities actually are very familiar to use this system. So for us, it was very easy to roll out vaccine, because also we had that experience of using Ebola vaccine. The Ebola vaccine we used in 2018, 2019, when there was an outbreak in DRC. So actually it is the same vaccine which require the same temperature as the Pfizer we're using today, -80. So to keep this vaccine at -80, so you can understand we had this experience, we had this infrastructure. So actually it was not something new for us. Even if you look at our health personnel, our staff, actually they had this experience. So there was no pressure on this side. So instead, because actually we had a very good space where to keep these vaccines, and at the beginning there was very few doses coming in the country. So actually we had that issue of not having vaccine while there was so many people in need. So on our side, we think that also the existing experience, equipment, and also dedicated staff, it was really something which helped a lot.
Yeah, thank you for that. And Dr. Hassan, your audio is coming through clearly. Hopefully we can also have you back on video if that works. So Dr. Wessam, then over to you. What I'd like to actually now touch on is the continent-wide response. I think what we've heard from Dr. Hassan and Dr. Lucy are sort of the country level systems. Both Dr. Hassan referenced data systems, Dr. Lucy referenced the personnel, the training, and the people. From a continent perspective, can you speak to what Africa CDC has been thinking about, and what are some of the great successes that you see in terms of the preparation and lead up to COVID?
Thank you, Nithya, for this opportunity to speak to your audience about the experience of Africa CDC when it comes to response to COVID-19 pandemic. And let me take a step back and speak about the history of establishment of Africa CDC as a continental public health agency to support member states to respond to this emergency. This dream started 2013 in the summit in Abuja for the heads of states, where during this time they believed the importance of having continental public health agency. 1 year later, unfortunately, the continent was hit with one of the worst Ebola outbreak in West Africa. And this increased the importance of having this agency. And since then, the African Union started working on establishing this organization, through consultation with different partners, a lot of tours to see different experience from different places in the world. Then starting from 2015, started the recruitment of a core team from public health professional in the continent, and also the director, Dr. John Akengeson, to be leading this work for establishing the organization. And officially, January 2017, Africa CDC was established with the vision to have safer, healthier, prosperous Africa, in which member states able to prevent and also have a good surveillance system to detect emergency and be prepared and respond efficiently to different emergency. And the mission to strengthening the capacities and the capabilities of African public health institutions to be able to play this role, early detection, rapid response to various emergency. This dream started 2017 with this official launching. Almost before the end of the third year, we faced unprecedented pandemic, this COVID-19 pandemic. And this bring a big test for Africa CDC, and this idea to have a continental public health institution to lead the work of the continent and coordinate between the member states to respond to this emergency efficiently. And we started building on the strength that we have in Africa CDC, and as Africa CDC embedded within this big political organization, African Union Commission, and having access to heads of state and minister, and how can we move forward as one unit, as a continent, to respond to this unprecedented epidemic. Almost 1 week after the first case reported in the continent in Egypt, mid of February, Africa CDC invited health minister in Africa for emergency ministerial meeting to put in front of them proposed Africa joint continental strategy for COVID-19 pandemic, for responding to this pandemic, and also proposing structure for coordination, collaboration between the member states. Health Minister endorsed Africa joint continental strategy to put the strategic direction for how the continent will be moving as one unit to respond to this emergency. And also they endorsed AFCOR task force, Africa Task Force for COVID-19, as a continental structure for coordination, collaboration, communication between the member states. And let me tell you about how this structure is functioning. At the top of the structure, there is what is called African Union Bureau, that is composed of 10 heads of state, in addition to African Union Commissioner Chairperson and Africa CDC Director. This access to those heads of states help us to inform them on a bi-weekly basis by Africa CDC Director about what is the situation on the continent, what is the directions that we need as a continent to be moving forward, and get the strategic guidance for how can we moving forward. Under this committee for heads of state, we have 3 ministerial committees, one for health minister, another one for transport and logistics minister, and third one for finance minister. Then we have 7 technical working groups. Each one of them include experts from the member states. They are the one near from the country. We need to build on the existing expertise of the continent. We have experts from Africa CDC, from WHO, other UN agency. And those technical working group gives a strategic guidance for Africa CDC about the technical work need to be implemented. Then we have incident management structures that implement all these directives and start taking forward the strategy to the actual life and supporting the member state. This is how the structure, the content from the continent perspective was operating in the last 2 years in responding to the COVID-19 response. And over the last 2 years, we start tracking what is happening in the continent, what are the challenges that we are facing, and start launching different initiatives. Each one of them focus on the challenge that we are facing during this time. For example, at the beginning of COVID-19 response, we have noticed that limited access to lab test kits. Most of the countries, you don't have access to those lab test kits. Very few in increasing the number of test kits, lab testing conducted in the continent. So during this time, almost in April 2020, we launched PACT initiative, Partnership for Accelerating COVID-19 Testing. And during this time, we raised alarm from the continent. This is a challenge that we're facing at the continent during this time. We need support from all the global partner and the global community to push this agenda forward. And we set a target within a month. We need 1 million tests to be deployed in the continent. Within 4 months, at least 10 million tests. And we exceeded this target. Now we have more than 100 million tests conducted in the continent. We launched also quite a number of initiatives like Africa Medical Supply Platform, AMSP platform. We have noticed that limited resources available when it comes to infection prevention control supplies, masks, gloves, all IPC material. It was great challenge for most of the member states. We established this online platform where we are giving access to the member state and connecting them with the global supplier and manufacturer. So they have access to this supplies. Again, AVAC, African Vaccine Acquisition Task Team, that enable member states to have access to vaccine with the challenging situation of getting access to COVID-19 vaccine. So this is what we try to do over the last 2 years to seize the challenging, launching different initiatives to deal with those challenges. And this is guided by one strategy for the continent. We changing this strategy based on what is happening and also the strategic direction from heads of state and ministers. Over to you.
Thank you so much, Dr. Wessam. So that continent-wide perspective is helpful. And so now I'd like to go to Dr. Andrew. I think what you did also, Dr. Wessam, is you kind of zoomed us out from the vaccine program to looking more generally at the entire health system, lab supplies, medical equipment, et cetera. And so, Dr. Andrew, what I'd like to do is actually now take that broad view of the health system. And could you talk about what are key lessons learned from the pandemic in regards to the health system as a whole? And also, you and I have spoken quite a bit about the role of data. So if you might also talk about the role of data in that.
All right. Yeah, thanks very much. And all colleagues, as well as fellow panelists who have already spoken. I think when it comes to health systems, the biggest lesson that I would highlight is to indicate that COVID has given us an opportunity. Health systems had slept for a long time. I think it has been long since we had a pandemic. So I think we've been sleeping. And COVID has somehow reshaped or has awakened us to start thinking beyond health, beyond disease. So I think for the health system, COVID has shown us that health is just beyond a disease. So when we are thinking about the policies, it's time to think about health and all policies. Today, the world all over is struggling because of COVID, which is, if someone just thinks about a medical condition, then it's a big mistake because it has brought in lots of economic hassles, lots of, every sector has been affected. So, for the health systems to start thinking about the health in all policies. The other area is leadership. COVID has shown what it means to be a leader and what it means not to be a leader. Countries that have got strong political leadership have responded quite well to COVID. And I think the other aspect is transparency. COVID has exposed and told us how important is transparency. We've seen countries that have been hiding data, and we've seen countries that have been transparent, providing data. And also it has motivated people to respond to data. The numbers have been talking. Interventions have been driven by the numbers coming out. We've seen it, countries being locked down, or people coming up with initiatives to lock down, depending on the numbers that were coming out, clearly telling us that COVID has given an opportunity to show that, that we can respond to data. So I think the other area that we may need to look into is readiness. COVID has provided also an opportunity for countries to always be ready for another pandemic. As we are globally, everyone is thinking what wave is coming, how will it come like? There is almost uncertainty. So in essence, I think one of the opportunity for health systems that we need to focus on is to always be ready for another pandemic. Our systems should be set to respond. I liked what Dr. Hassan has indicated, emphasizing on the use of existing systems. So the other opportunity that I think COVID has taught us is integration. You don't need to design different systems rather than strengthening existing systems. If it's immunization, we saw some countries when the vaccine was just introduced, people wanted to develop different monitoring systems. They wanted to bring in different supply chain systems away from the existing, the routine sort of system. Malawi was one of the countries that started at that sort of level. But eventually, it has proved so successful that if we use the existing systems, it works much better. So if we are looking at monitoring, we need to look at strengthening the current existing systems. Innovation is the final area that I wanted to highlight as an opportunity for COVID. We've seen lots of innovative initiatives to respond to COVID, both in the digital space, as well as I think the way we do things different. So I think these innovations need to be documented. When it comes to data, I always see I'm an advocate that data should follow a service. Data should be the third thing to think about. The reason is that we have a lot of data in the health service that is not being used. Every country has a huge, robust data, but the countries don't even have a motivation to use that data, or they don't see the need to use that sort of data. So normally I do ask myself, how long will we be keeping on collecting data? So first things first, as a health system is there to serve patients, to bring better outcomes for patients. So any system innovation that we are bringing in should first of all target at making better life for patients that we are serving. The second aspect is the user. Mostly in Africa, even in most of the Asian countries, you will find out that there are so many innovations that are brought in, even systems to generate data, but they don't think about the context. There are people who don't know how to use the computer, even a mobile phone, a smartphone. But you find that people are developing data generating systems and bringing them to people that have never used even a computer. So I think we need to think for any system, and when we are thinking about the data, we need to also think about the user context, the user-centeredness. The final thing is that I believe that any system that is able to bring out, that is able to respond to patient needs, that is used by health workers or the users, it will obviously bring data, and data of good quality. Data use, finally, is something we need to think about. Almost all countries are pulling data from service delivery sites, and the data is being used for decision making at higher level, but not at the facility where that data is generated. So I think we need to start thinking about better ways of bringing useful data to the people that are generating the data. The data should be responsive to the needs of those people. I don't need to wait until 6 months. So that's why personally I have problems with systems like DHIS too, because it takes longer for me to know that people are dying somewhere, or immunization coverage is going low in a sense. It takes not less than 3 months for me to know that. So I needed to know in real time when immunization rates are going down. Immediately, I should be able to know and respond. So not only at the national level, but even at the lower level. So that's what I would say at the moment. Thanks, Nikki.
Dr. Andrew, you're bringing up a number of themes, especially data use, that are very, very close to, I think, all of our hearts. So I want to make sure we touch on that, but I do want to take a step back, actually, because a theme that all of you have touched on is innovation and the introduction of innovation. So even before we get into this specificity of data use, I do want to take a step back and talk about that. Dr. Hassan, you've talked about some really interesting ways that Rwanda thinks about new solutions. Innovation is a buzzword, it's an overused word at times, but new solutions, whatever that might look like. You've talked about some interesting ways that Rwanda thinks about and designs new solutions. Can you share a little bit of that approach in terms of performance-based financing and that overall approach there?
Yeah, thank you, Dr. Nitia. So actually, this pandemic has shown that really behind every challenge, there is always also some opportunities. So for us, COVID-19 pandemic, so we think that actually we are going to use this opportunity also to have a very resilient vaccination program. Because actually, before the pandemic, actually everyone was thinking that really vaccine for children. But finally, we found that everyone can be vaccinated. So this is a good opportunity also to advocate for vaccination program and also engage our leaders. And because actually now they know that everyone can be vaccinated. So that is one. But also if you look at the solutions we have in Rwanda, and it is not new, it is not because of this pandemic. So actually to make sure that all our indicators are very high, we are achieving what we have planned. So there is so many solutions, homegrown solutions. Let me talk about PBF, performance-based financing. So actually it is in our culture today to say that this year I will achieve this. So you set up your goal and you have to make sure that you are achieving that goal because, at some point will be evaluated. It is not only at the ministerial level, but it is also at district level, hospital level, in health centers, but also in households. So in households, actually we find that parents are being asked to commit that they will achieve 1, 2, 3, 4, 5 indicators, including I will make sure that my children are very well vaccinated. So I will make sure that I'm following up family planning. So I will make sure that actually we will improve hygiene and sanitation in our home. So those are basic in a household. But if you look at the ministerial level, so we commit to make sure that every child is vaccinated. The coverage will be 98%, 100%. So these are kind of indicators you'll find in our performance. Actually, we send those performance contracts. So this is something really very important. But also, if you look at in health facility, we are evaluating on a regular basis, on a quarterly basis. So this helps us actually to bring our health facilities to one level to another, because actually it is not only indicators, but also in terms of skills of healthcare providers, equipment, infrastructure. So we have to commit that actually we have to move from one level to another. So one is that is about how we are trying to achieve what we have planned. But also if you look at like digital system here in Rwanda, so we are trying our best to move from traditional method using paper to digital solutions, so that we reduce also that running costs related to these registers and also cards we are printing. The health sector is very expensive in terms of medicines, personnel, but if you look at also running costs, which we are using in different systems like data collection. So it is very expensive. So after this pandemic also has shown that it is time to move from those traditional methods to new solutions. So for us, we have vaccinated now more than 9 million people. And those people vaccinated actually are not providing a card. So it is themselves, because actually when we are vaccinating someone, we send just a text message where in that message there will be a link and also the code. And that code will be used as a login, as a credential to access the vaccination certificate. And himself or herself will go outside to print. So this is something really we think that it will help also even after this pandemic, because it will be a good opportunity also to make sure that even for vaccination program, we move from this paper-based system so that we can use this solution, because actually we see that we are benefiting a lot in terms of money. We are no longer giving so many money to print and have registers and the card. Thank you.
Dr. Lucy, could you talk a little bit about what are the kind of key learnings that you are taking away from this pandemic?
Yes, thank you very much. Some of the key learnings, of course, is preparedness for the future. And also, while we prepare, we also protect the current. As you have heard from the previous speakers, the issue of protecting the routine immunization and also leveraging on routine immunization. So preparing the routine immunization for the future in case of any pandemic, that is one thing that we need to strengthen. So as we strengthen the systems, let's think of strengthening the routine immunization, strengthening the infrastructure so that next time, God forbid, we are also prepared for any eventuality. And also embracing innovation as the issues that Dr. Hassan has talked about. It's quite different approaching the current population, the adult population from the children. So embracing new ways of reaching this population is one thing that we have to look at for the future. So I could say those are the key learnings that we are having, and of course, continuous learning. We know that immunization is changing. We are now moving to a life course of vaccination. So we'll have to be learning from other countries as we are learning here also from what people are doing in the various other countries, learning how to approach the different populations with the different vaccines that we have. So all this is just the issue of continuous learning is something that programs have to inbuild within their systems. Thank you.
I have a few follow-ups with Dr. Lucy, but I want to come back to them because I want to pick up now on this thread of continuous learning, actually. And Dr. Wessam, if you could give us the sort of the view of the future. You know, Africa CDC, I know, talks about a new public health order, but if you could first start about this learning. You know, Africa CDC has done so much to kind of set up these regional partnerships, serving the member states, as you've talked about. Could you talk a little bit specifically about this continuous learning and how the role Africa CDC is thinking about playing in terms of catalyzing and stimulating that ongoing learning of countries from each other?
Thank you so much. As the previous speakers mentioned, yes, emergency came with challenges, but also at the same time come with opportunities. And we need to build on those opportunities in order to avoid similar challenges in the future. And as I mentioned by AFCOR, this is a way for coordination, collaboration, communication between the member states. The structures that Africa CDC is operating, we have headquarters within African Union Commission, and we have 5 regional collaborating centers. one embedded in each region. And those regional collaborating centers, they are driving weekly and sometimes bi-weekly conversation between representatives from the member state to share their experience, what is working, what is not working. And this kind of forum to share this experience, it helped to make the story short. We tried this approach in country X and it didn't work. So there is no need to repeat it again. Or we tried approach Y in X countries and it worked. So we can get benefit from them. So this kind of forum and sharing this experience between the member states, this is already in place. And also every now and then, based on the progress of the COVID-19 pandemic, we are calling for emergency meetings, sometimes for a minister level or sometimes for high technical official to discuss with them the challenges that we have during this time, or some of the warnings that alert that we need to raise as Africa CDC based on the analysis and data that we are collecting and seeing the trend of COVID-19 pandemic and how the progress of disease happening in other continents. And we use this similar forum to raise the alert among the member states and agree about our approach to move forward. And in this regard, as building on what we saw over the last 2 years and how to benefit for it and set a strategy for the future, Africa CDC is launched what is called New Public Health Order in Africa. And this is based on 4 main strategy we'll be focusing on in the coming period. The first one, how to strengthen the National Public Health Institute at member state level and also regional entities that work in public health. One of the big lessons learned that we learned from COVID-19 response. This issues related to global solidarity was questionable during COVID-19, and bending on big international organization, especially during a tough time, was a big question around their performance. And in the best case scenario, the support that you are getting support too late. So this raising the alert about we need to strengthening our national public health institution. As Dr. Lucy, Dr. Hassan, and Dr. Andrew mentioned, we need to strengthen our local capacity in the continent. And also the regional entities, similar to the example of Africa CDC, to have regional entities able to coordinate the work between the member states. I think this is present the success stories can be built on in other continents. And second part under the new public health orders, strengthening local and regional production capacities. And this is also was important. Having access to COVID-19 vaccine was really tough over the last 1 year. Early access to IPC supplies at the beginning of COVID-19, very tough, big problem. All the countries are competing to get access to those IPC supplies. The same test kits, enough resources. Even if you have the financial resources, you are not able to get access to some of those commodities like vaccine test kits during the beginning of COVID-19. So this is raising the importance of having local and regional manufacturing capacity in the continent. This is why Africa CDC is pushing the agenda for Pave initiative, partnership for vaccine manufacturing in the continent. This is not for COVID-19 per se, but this is a look for the future. The continent is producing only 1% of their needs of all different kinds of vaccine, and depending on 99% of the vaccine is imported from outside. We are looking through this partnership for vaccine manufacturing initiative led by Africa CDC to have by 2040, 60% of vaccine needed in the continent to be produced within Africa. And this not covering all, when we say local manufacturing capacity, we are not looking only for vaccine, but also looking for medicine, looking for diagnostics, looking for infection prevention control supplies, and so on. So we are looking holistically to production capacity. And third pillar is workforce development. This is the real army on the ground when it comes to public health emergency. And we're looking holistically to workforce development, not only doctors, nurses, but public health professionals in different capacities. We need epidemiologists, we need data manager, we need people specialized in risk communication and community engagement, social science. So we're looking broadly for this one, and also the leadership that understand what do we mean by public health emergencies, how can we take quick decision to respond to those emergencies. And in this regard, Africa CDC launched Kofi Annan leadership fellowship program. This is to have new leaders for public health in the continent. And last pillar under this new public health order is partnership. We believe in partnership and having good connection with different partners across the world to strengthen the capacity of our member states. But also we need this partnership based on mutual respect, based on we know what is our challenges in the continent, as my colleagues mentioned. Sometimes you have already existing system in place. We don't need to build something new, something from the scratch and bring it to the continent. We have good experience and we have good experts able to respond to the emergencies and the challenges that we have in the continent. So don't come up with imported solution. Discuss with the experts from the continent, from the member state, from regional entities, what will be best work for the continent, and let's agree on the agenda and let's move forward together. So those are the 4 pillars that we are putting on the stage for a new public health order in Africa. Over to you.
Thank you, Dr. Wessam. So one of the themes that you've touched on, there's a number of themes here, but one I want to pick up on and follow up with Dr. Lucy and Dr. Hassan is workforce development. So Dr. Lucy, maybe we could actually start with you. You've talked about a little bit the uncertainty that was there during COVID. There was very little guidance, especially at the beginning. There was a lot of change. It was a very dynamic situation. These can be some of the most challenging moments for a leader. Can you talk about how did you manage during this uncertainty, and especially how did you manage to keep your team, who you've talked about being the lifeblood of the EPI program, how did you manage to keep your team engaged and moving forward during this time?
Yes, as you've said, Nithya, there was a lot of uncertainty during this period. Before the vaccination program came up, and even after the vaccination program came up, on issues with continuity, what happens to people who need to be vaccinated during lockdowns, and such issues were coming up often. The best, of course, was to consult and what is happening around, what is happening in other sectors, and of course, to have honest conversations with the staff, and to also acknowledge where there is uncertainty, to acknowledge uncertainty to the staff, and to provide guidelines that could operate within that uncertainty level. For example, we provided guidelines on continuity of providing immunization services during the pandemic and during the lockdown, and also guidelines on health workers using PPEs during that time, that is the protective equipment, to ensure that we continue vaccinating, and also just providing to them the justification of why we need to continue vaccinating during that time. So I can say that there's a lot of consultation that needs to happen during that time, and also just sometimes to use your gut feeling at that point, and to be able to steer on, because as we know, there's a lot that we didn't know about the pandemic, and knowledge was coming in every so often. So we would be able to use that knowledge to guide future actions. So that's what I can say about that. And keeping on informing the staff and engaging them, because usually when there's information vacuum, that is when problems come up. But when they know that you are listening and you're also providing them with all the information that you know, then they're able to proceed more confidently. Thank you.
Thank you, Dr. Lucy. So just in the last few minutes, I want to make sure that we can hear from Dr. Hassan and Dr. Andrew. Dr. Hassan, maybe you could also talk briefly about, you've talked also about the the commitment of the team in Rwanda. Could you talk a little about, how you've also kept the team engaged across the country?
Yeah, thank you, Dr. Nitzia. So normally one of the challenges you have in the health sector in Rwanda, it is the turnover of health personnel. So actually it's not easy really to maintain all of them in their working place. And sometimes it is normal, and we understand that. Because actually most of people, there is so many staff who are very young. So sometimes they have this dream of moving from rural area to cities, and it is something really everyone can understand. But really during this pandemic also it is very challenging, because you can understand there was so many duties, and also if you look at their work, actually they were overloaded. So to make sure that we can maintain people in their working place, what we did is just to recruit new staff, so that we can reduce the burden for those who are already in a working place. So for us, for this COVID-19 pandemic, so to make sure that we can vaccinate so many people in a very short period, so we hired almost 1,000 nurses, new nurses, deployed in the health facilities across the country, and also around 400 data managers. So you can understand it is something motivating also those staff who are already in health facilities. But also we had the chance of having our, we have a very good, very functional system of community health workers. So actually, this is also something which motivated, because actually also, even though they are volunteers and we are supporting them, we are motivating them through their cooperative. So it was also something which helped a lot. And in addition to these existing systems, actually you had also the chance of having youth volunteers. So youth volunteers, they are very young, graduate from colleges. So we trained them so that they went everywhere to support, because if you look at each sector level, you'd find that there is at least 20 of them supporting these activities, most especially COVID-19 vaccination. So these are motivation, because, for us, with the commitment also of our leaders, I have also to say that, because actually with also support of high leadership. So actually it was very easy to manage this pandemic. And also I have to say that if you look at the number of personnel we have in EPI, actually before COVID, so the total staff we had in EPI, including those one in charge of logistics and those one in charge of routine immunization, surveillance, actually we were at 10. And if you look at today, so actually in logistics only we have 10 people. So you can understand also we had a good support from partners. And also it helped also to make sure that even those one who were already in the place, so they felt that really they are supported. So it was very easy to manage to maintain them. So otherwise we couldn't manage as EPI this pandemic, this vaccination, it's very huge. It was not easy. Because if you take even numbers, so we have vaccinated almost 9 million for 2 doses now. We have also started the 3rd dose. And we used to have a birth cohort of 370,000 per year. So you can understand to vaccinate 9 million people in only 1 year, it is something really very, very big, which could not be managed only by EPI. So we have this chance also of having good partners and stakeholders.
Thank you, Dr. Hassan. Dr. Andrew, we'll give you the last word in the final minute. And I'd like to actually quote something that you've said to me back to you. I hope you don't mind. You said to me a few weeks ago, anyone who holds data holds power. I wonder if you could just, kind of help us close out the session and just talk a little bit about the role of data ownership, and really, as you've talked, extensively about data use, what do you see as kind of the future here?
Yeah, I think the data determines the future. Data determines. I think data will be another huge change in the global economy. So in essence, everyone is fighting for data. Countries do have data. Donors are fighting for the data. But I think the key will be who owns the data and who uses that data. Countries should be supported to appreciate the use of data, mainly in real-time decision-making. I think I do appreciate that even immunization is going through huge, tremendous issues because data is coming in the hands of managers routine basis. So I think to promote data use by those who hold data or who generate data, I think it will be a major thing that we need to drive into. So countries that really put effort in strengthening data generation, data quality, data use, those countries will be stronger than countries that don't have that data.
Thank you so much. And I would add to that data ownership. I'm firm believer countries should own the data, that there shouldn't be any of these arguments that you are referencing. But thank you so much to all of our panelists for an incredibly engaging conversation. I'm really grateful to you and to our audience. Thank you so much. Goodbye.
Thank you. Bye-bye.
Thank you, Nitya.